I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today is black belt health. And I've talked a lot about nutrition in the past, and I will talk about a lot in the future. I'll probably cover it today too. But nutrition is really important because that's something you have control over, what goes in your body. But I also want you to understand that you have control of your environment in many cases too. So the first half of the show, we talked about environmental things that you can do around your house, getting a healthy house. If you're just tuning in, this show will be on our website, drjoe.com. So if you're interested, if you like what you're hearing, we have over 1,500 hours of podcasts on the website. We have audio, video, blogs. So if you're interested in this type of information, drjoe.com, just go into media, and we've got tons of information there. If you like listening to blogs or podcasts, any podcast service you use, type in Dr. Joe for the Health of It. That's the topic of my first book, Eating Right for the Health of It title. But Dr. Joe for the Health of It, and you can have your podcast services bring you Dr. Joe 24 hours a day, 7 days a week. So there's tons of information out there. If you have a question, you can always send it to me through the website, drjoe.com. Now, in most cases, if you just search the website, we've done a show or a blog or an article on it, so you can feel free to do that. But if you have a question, a little bot pops up and it says, would you like to chat? And you can send us a question. If we're online, it's me, Garrett, or Joe. If we're online, we'll answer it immediately. If we're not, we will get back to you. Just put in your email address, and we'll get back to you right away as soon as we can with your question. So we want to be your doctors. We want to get you well and keep you well. So if you have a health issue, we want to be the people you turn to. And again, we don't have all the answers, but we usually know the guy who does have the answers. I always say, I know the guy who knows the guy. So we're more than happy to help you in any way we possibly can. Our offices, we offer chiropractic, we offer medical care, we offer PRP, which is regenerative medicine. We offer nutrition evaluations, supplements, digestive issues. So on our website, we have a list of all our services. Laser work, we just added laser to our treatments. It's all on the website, drjoe.com. I don't think laser's up there yet, but Garrett's going to put that up there hopefully soon. So we offer a ton of services, and we want to be your doctors. Well, hopefully we're going to start getting rapid COVID testing as well that we can actually send to you. We're working on that now. I'm checking the efficacy of these companies. But there are tests now that you can actually do and get the results in 10 minutes. So we should have that out pretty soon as well. So I am always on the hunt to try to find new information for you about healthcare that's going to help get you and your family well and keep you well. So that's why I want to be your doctor. If you want to make an appointment to see us, we'd love that too. And people come from all over the world to see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, and you can do that right on the website, drjoe.com. So people come to me all the time, and of course we get a lot of questions. And people say, Dr. Joe, what should I do for this? And many times I have an answer. But sometimes it's an emergency. And I've had to beat people over the head sometimes because they'll say, well, Dr. Joe, no, I'm going to let you guys fix it. Your doctors are great. I'm going to let you guys fix it. Sometimes you need medical care. Absolutely, positively. And if that's the case, I've had to argue with patients. No, you need to get to the emergency room now. Maybe we'll take an x-ray of somebody and we'll see they got a dissecting aortic aneurysm. And if it's 55 millimeters or more, that's an immediate emergency. And I've had people come in at 50, 51, 52 millimeters, and it's like, you need to get to a surgeon now. Oh, no, doc, it's fine. I'm just going to change my diet. No. You're past the point of no return here. If you ever watched the Phantom of the Opera, there's a great song, The Point of No Return. And you're past that point of no return. You need to get to emergency care immediately. So there are some things, when the symptoms are serious enough, I don't want you to ignore them. I remember years ago, I was one of my mentors. He said, Joe, don't be a taint nothing doctor. And I said, I don't know what that means. He says, don't say, oh, it ain't nothing, don't worry about it. Ain't nothing. It ain't nothing, don't worry about it. Because if you do, many times that could become a serious issue. Because I'll take x-rays of patients, and we'll put the x-ray up, and I'll say, you've got severe arthritis, you've got degeneration, you've got an old fracture in your spine, you've got severe cord pressure, spinal cord pressure. You need treatment immediately. Well, it ain't nothing, doc. Ain't no big deal. I've been like this for years. I understand that, but you need treatment immediately. 99% of the patients get what I'm saying. Every now and then a patient knows more than me because they're much smarter than I am. And they say, well, I'm going to do it this way. Okay, Thank you, Frank Sinatra. You can do it your way. That's fine. Did it my way. Sinatra quote. We're both from Hoboken. Sinatra and I have a little connection there. And I fear for them. I'm frightened. A lot of music quotes today. I'm frightened for your children because you might die. And that's a Moody Blues quote. I'm frightened for your children because you have something here that's really serious. And you need to be taking that seriously. And sometimes people don't. And it's like, well, I've learned two things in my life. Don't argue with patients. Don't argue with women. Because I've never won an argument either way. But with patients, I'll tell them what they need. 99% of the time, they're on board. Every now and then, I get a wise guy. It's like, all right, you'll be back later. Or you may not be back later. Because you'll be dead. So start thinking about it. One of the things you can do is, if you're not sure, always err on the side of caution. So if you have chest pain, or you have pressure that lasts more than a couple of minutes, it might be time to call 911. Now, what other things can cause chest pain? Acid reflux, hiatal hernia. You have a sheet of muscle called the diaphragm, and below your diaphragm sits your stomach. Now, your stomach can push up into your diaphragm, and that can cause chest pain. And I have a lot of people that have had chest pains, go to the emergency room, go to the cardiologist, they get a whole workup, stress test is negative. The heart's in great shape, awesome. Now let's see what else it is. Maybe a stomach issue. Let's massage or pull the stomach away from the diaphragm. And in many cases, that helps acid reflux, heartburn, burping, gas, bloating, chest pain. So a lot of times it's stomach out of place. Could be a pinched nerve. From a chiropractic standpoint, you may have a pinched nerve in your mid-back, and that's the nerve supply that wraps around through your ribs into your chest. Could be a misaligned rib in the front of the chest. That could be something we have to address. Could be the sternum out of place. So it could be a physical issue. But if you're having, and we talked about this in the past, women usually have more anxiety, feeling of doom. Men usually have shooting pain down their left arm and chest pain, like an elephant is sitting on their chest, can be a bad one. Don't drive yourself to the hospital. Get somebody to drive you, call an ambulance, get there as quickly as possible. Because the ambulance, of course, they're trained professionals, and you may need CPR, you may need an injection. So, you don't want to jerk around with chest pain. It's not something you want to, fiddle with. Now, if you have your test done and the doctor says it's negative, then you need to come see us. Because it's usually either a heart attack, which is very rare, but not uncommon. But many times it's a stomach out of place, it's a rib out of place, it's a bone in the spine out of place, and that's more of a chiropractic issue. So we are here for you, and we get patients all the time. They've exhausted everything else. They've gone to their doctors, they've had their blood work done, they've had their MRIs, they've had their CAT scans, and maybe not just chest pain, but a lot of problems. There's nothing else we can do for you. Then they come see us, and it is a pinched nerve, or it is a stomach issue, it's a digestive issue, maybe it's a nutritional issue. And we fix it, and they say, why didn't I do this sooner? Why did I wait so long? And I, for the life of me, don't understand why, if somebody has back pain, they're not going to a chiropractor first. Chiropractic is the most effective, least expensive treatment for back pain. Now, when is it not a chiropractic case? Well, shooting pain down your left arm and an elephant sitting on your chest. Now, shooting pain down your arm could be a pinched nerve too. Loss of bowel and bladder control. That could be a ruptured disc. It's a medical case right away. Pain so severe that you're passing out. It's a medical case. But after we get that under control, we're here for you. So we want to be your portal of entry. If you're not a case for us, we always send you out for treatment and then come back to us later on once the life-threatening situation is stabilized. So these are things, what we're talking about now is symptoms you should never ignore. Shortness of breath. If it happens suddenly and keeps you up, keeps you from your daily activities, it might be an issue. Now, sometimes it's asthma. And it could be chemically induced asthma. You're allergic to dogs or cats or wheat or dairy. Those are the two big food allergens. Could be a pinched nerve. I've seen many asthmatics with a pinched nerve in their neck and they can't breathe because that's the nerve supply, lower part of the neck, that's the nerve supply into the lungs. We go in and adjust them from a chiropractic standpoint and they're able to breathe suddenly. And that's pretty cool because I've seen that happen a lot in my career. It could be the stomach pushing up against the diaphragm. So your diaphragm can't drop down. You can't get air into your lungs, and then you can't breathe. So there's a lot of different issues. You could be having a heart attack or a pulmonary embolism, which is a blood clot in the lungs. So again, depending on the severity, it might be something you don't want to ignore. You might want to get medical health right away. If suddenly you lose your vision, if suddenly happens quickly, your vision becomes blurry. A couple of years ago, I remember I started seeing flashing lights out of the corner of my eye. And I remember there was a child in the back seat of my car, and I thought, I said, why are you flashing the light? Why are you playing with flashlights? She goes, I'm not. I thought, okay. So it kept up, went to my eye doctor, and she said, as you get older, there's issues where the retina can actually become a little detached. And she said, it's nothing to worry about. Let's monitor it. And within a day or so, it was gone. But what did I do? I went right to the eye doctor. I want to make sure this is nothing serious, and it wasn't. It was no big deal. So if you get dizzy, numbness, vomiting, confusion, trouble talking, these could be signs of a stroke, could be signs of a visual issue, a brain issue, a brain embolism or aneurysm. So you don't want to play around with that. And once again, I even called my doctor on a Sunday, and she said, well, I was just about to go out. I was going hiking or something like that. She goes, I'll meet you at my office. She showed up at the office in her hiking clothes. She checked me out. She said, you're fine. It cost me a little more money, but you know what? It was worth it. Because what if it was something more serious? Wasn't. But if it was, I would have wanted to get there. Because the quicker you get to something like a stroke or an aneurysm, the better chance you have of survival. So again, I can't fix everything, but I can fix most things. And we have a protocol for just about everything, but sometimes it's a little outside of that range. If you burn yourself, you might want to get to the emergency room if it's a large part of your hands or your feet, your face, your groin, your knees, your elbows. If it's a real bad burn, and that would be what we call a level 3 burn, a third-degree burn, bigger than 3 inches, if it's charred, if you don't feel pain. Okay, I burn myself, it hurts. I burn myself so bad I don't feel anything, and yet the skin is all charred and it's white and it's blistering. That's a third-degree burn. What did I do? I burned the nerves. That may need medical treatment, and you don't want to jerk around with that because you can get scar tissue. And scar tissue could really be limiting, not only just aesthetically, but it can also limit function. And scar tissue, we have flows of energy through the body. You don't want to interrupt the flows of energy. With chiropractic care sometimes, the bone is out of place. Not only does it pinch the nerve and cause pain, but it affects something called the chi, the flow of energy through the body. And this is from Oriental medicine. And so scar tissue can block chi. And sometimes we have to go in there, and we have special adjusting tools we can break up scar tissue with. Works really well. We have a laser. We can laser scar tissue out sometimes. It doesn't hurt. You don't feel anything with the laser. But there's a lot of different treatments you might want to do. And that's why with burns, you don't want to joke around. If you start vomiting, all of a sudden, you don't know why. If you vomit and it looks like coffee grounds, okay, that's very serious. That could be cancer. So if you're vomiting and you don't know why you're vomiting, now, yeah, you drank too much booze, you throw up the next day, not that big a deal. Maybe you got some food poisoning. Not that big a deal. But if it's continuous vomiting, you start losing consciousness, you start getting dizzy, this is something you might want to consider dealing with it right away. Traumatic brain injuries. We deal with a lot of traumatic brain injuries in our offices. How do you get them? Sports? Question for you. I'll answer it for you because this isn't, you have no way to talk to me now. Football. You've seen football. What position do you think has the most traumatic brain injuries? A quarterback gets tackled a lot. If you're a receiver, you get hit. While you're running, you get hit. The linemen get the most traumatic brain injuries because every play, they're usually butting heads or they're ramming their head into something or you're thrown to the ground. Of course, I played line. I played offensive and defensive tackle and center when I played football, and a lot of traumatic brain injuries. And so with that, chiropractic care works real well, but then we have neurologists we work with, or neurosurgeons, but also we have a laser treatment. We can do laser for traumatic brain injuries, and the laser can actually penetrate in through the skull and activate what's called the mitochondria in the cells, and the mitochondria produce energy, and in many cases it revitalizes function of the body. So traumatic brain injuries, you definitely want to come see us for that. Sometimes we have to refer out to a neurologist or a neurosurgeon, but then we co-manage the case. So the doctors I work with, we always co-manage the case. So you do your medical stuff, and we have a medical doctor as well, but he's more regenerative medicine. So arthritis, non-surgical facials, hair replacement, we use something called PRP for that. So it's regenerative medicine to keep the body young and healthy, and then sometimes we have to go outside that. Now, even with PRP, it's your platelet-rich plasma. It's your own cells from your own blood concentrated down. We put it in a centrifuge, and we can inject those cells back into your body, and it stimulates new growth. And it can be used everything for erectile dysfunction, way less expensive than most treatments and very effective in most cases. If women have sexual dysfunction, if they have bladder leakage, you can put the stem cells back in there. Well, it's called an O shot or a P shot. My doctor is certified in O and P shots, it's called. Hair replacement, again, you're totally bald, it probably isn't going to work, but if you have, male pattern baldness, many times it works great. But arthritis, knee arthritis, shoulder arthritis, spinal arthritis, folks, It's your own cells. It's relatively inexpensive for what you're getting, and it's something I'd recommend you consider before you do anything else. And you can always set up a consultation with us if you want to. But we're talking about times to call the emergency room, time to when you don't want to ignore these symptoms. And I got off on a tangent there. Cuts. If you see yellow fatty tissue underneath, you should get to the emergency room. If you will need quick attention sometimes, if it's on the face, the neck, the genitals, across a joint, that's you need medical care. I've told the story a while ago. I was in my yard, and it's the same injury, by the way. Somebody said, "Oh, you hurt your finger again?" I said, "No, it's the same injury." I was trying to move a big boulder. I was planting some trees in my backyard to create a natural barrier between my neighbors, and the pick slipped, and my finger got crushed. And I pulled my glove off, and the whole tip of the finger peeled back, and I saw the bone underneath it. Oh my gosh! So I washed it off. I went to a walk-in clinic, and the doctor said it's a perfectly clean cut. You washed it out. You did everything you were supposed to. You got here right away. We can stitch it or not. What do you prefer? I said, I prefer not to stitch it. They said, okay. And it healed fine, and it's 99% of what it was before. So with deep cuts, that's not something you want to jerk around with. If it's really deep, you see bone underneath it. If you start seeing fatty tissue underneath it, go get that checked because you can get an infection or worse. So that's not something you want to play around with. So again, there are times when coming to see us is definitely the protocol. If you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, radiating pain, probably come see us first. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Even Saturdays, we're even open in Marietta office. So we have 6 days a week we can service you. So come see us for those issues. The issues we're talking about today, we might want to consider an emergency room visit or medical evaluation, and then when you're done, come see us and we'll work on getting you well. If you have nutritional concerns, okay, I'm double board certified in nutrition and a BS in nutrition. I'm a retired dietitian. I write books about it. I've been studying biochemistry, neurophysiology, and nutrition for 40 years now. We want to be your doctors. My team of doctors now. Of course, I don't see all the patients, but we want to be your doctors. So if you're serious about wanting to get well, go to our website, drjoe.com, make an appointment. We can get you in pretty quickly. The first visit is normally $375. That's an exam, x-rays, consultation, first adjustment, and going over the x-rays and the nutritional evaluation on a second visit. And we've reduced that to $199. We do accept insurance for treatment after that. We accept almost all insurances, car accidents, sports injuries, Medicare. Yes, a few doctors that still take Medicare. If you've ever been in a car accident, I say this all the time, and patients come in every day when they hear me say it. If the car was damaged, you were damaged. I saw a patient yesterday, as a matter of fact, and he said, "Doc, I was in an accident a year and a half ago, and I'm still having problems. And I heard you say if the car was damaged, you were damaged." But he says, "I went to my medical doctor, and they did an evaluation. They said, there's nothing else we can do. Go home." He says, "I've been suffering for over a year now." He says, "And the car was damaged." He said, "So can I see you now?" I said, "Yes." It doesn't matter how long ago the accident is, but if the accident is right away, you come see us, the chances are, A, we'll get better results, and B, when you're dealing with insurance companies, they can be, I won't say the word, they'll say, "Well, you didn't go to the doctor like that day." I literally had a patient the other day. The accident was on a Friday night. She came to see me Monday. Insurance company said, "Well, you didn't get to the doctor fast enough." She said, "It was Friday night, Saturday morning. I couldn't get to a doctor. Everything was closed." And so that's like their canned answer, their cheesy answer of saying, "Well, you weren't hurt if you didn't go to a doctor." So we had to write up a letter, and we got it approved, and it was okay. But the quicker you get to us, the better you're going to be. And everybody in the car needs to get evaluated. So if there's nothing wrong, we'll say, "Hey, there's nothing wrong. We had one evaluation, go home." But if there is something wrong, you definitely want to get that fixed. So if you do want to make an appointment, we would love to be your doctors. drjoe.com. You can book it right online. There's phone numbers on the website if you want to call us. But each office has its own calendar. Click on the calendar, set up an appointment. We'll call you like the next day or the day after to discuss it, give you all the information, make sure the time's available. So we want to be there for you. So stop suffering needlessly. Biggest complaint I get is, why didn't I do this sooner? Supplement-wise, the minimum supplements you should be taking would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. One of my coworkers at the radio station, Milani Kai, we were talking on the air the other day, and she said, "I've tried these green powders and stuff. They tasted awful." She goes, "I like yours." She goes, "I had to stop taking it." I said, "I want to take more." She goes, "They taste so good." So I like the mint-flavored Super Greens, by the way. There's plain and there's mint. It's a little sweeter than mint. The plain is a little plainer. So whatever you like. If you like it sweeter, you like it less sweet, we have 2 options for you with the Super Greens. So we want to be available to you. The supplements you can pick up in our offices, or we'll deliver them for you. I do strongly advise that, especially now in the environment that we're in, you also take vitamin D. Vitamin D3, not vitamin D2, that's synthetic, vitamin D3. And I recommend about 5,000 international units a day. That's 5 drops. I always say vitamin D is the cheapest insurance policy you'll ever buy. So I take Super Green Essential Source, and vitamin D would be the starter kit, if you want to call it that. But on the website, we explain each supplement. We have about 20 supplements now. We explain each one, what they're for. If you have questions, you can always call us. But we can deliver the supplements. You can pick them up if you want to at our offices, save shipping. But I'm begging you, folks, please get on a supplementation. I don't think anyone doesn't need supplements. I think we all do. And ours are really good. A lot of them are raw, so the enzymes are still active. So I feel it's certainly no harm in erring on the side of caution. But I tell you what, most patients, when they take supplements, love it. So you want to make an appointment, get the supplements, more information, drjoe.com. Under the services tab on the top of the website, it has a list of all the services that we have to offer. We want to be your doctor, so stop suffering needlessly. All right, a couple more things. Almost out of time here. Don't ignore these symptoms. Men, if you have testicular pain or swelling, get that checked. You could be cutting off a blood supply. There's a lot of blood supply in the testicle area. If you start having severe pain down there, get to the doctor. Women, severe shooting pain in the ovaries. Sometimes there's a cyst on the ovary and it could burst, and sometimes it's benign. It bursts and it's fine. I had a friend of mine have that happen when I first met her, actually, and she had real severe pain. I said, go to the doctor. She went, and it was a little cyst that burst, and it was done. So it depends on how bad the issue is, but for men especially, with those blood vessels down there, it can get twisted, and torsion can come in, and it causes some real serious issue. Fever, of course, I think everybody's aware that fever is not something you want to play around with. If you have a fever above 104 degrees, you definitely want to do something about that. Try to bring the fever down if you can. One thing you could use is just isopropyl alcohol. Take a rag, put some rubbing alcohol on it, put it on your head. It cools it off and it draws the heat out. Fever is good to a point. Pain is good to a point. So fever can be good because it raises the body's temperature, and that can kill off viruses. So that's why, now we're saying 101.4. Anything above that, you definitely want to isolate now because of the environment that we're in. But you can get tests again. Hopefully we'll have these tests pretty soon. And for a baby, 100.4, not a bad idea to get that checked. But for adults, a little bit of fever, it's probably not that big a deal. The body's doing exactly what it's supposed to do. But if it starts getting too high, if you start getting delirious, if you start seeing things, hearing voices, definitely you may not know you're doing this, but if you have somebody in your life, get them to the doctor right away. Confusion or trouble speaking, that could be a sign of a stroke. Okay, tests we do in the office: puff up your cheeks, whistle, stick your tongue out to one side and then the other, blink your eyes. That's one sign of stroke. The body isn't working properly. It could be a brain issue, and the quicker we get to a stroke patient, the quicker we get good results with it. And we have a lot of treatments we can do with stroke patients: rehab, chiropractic neurology, functional neurology, laser therapy. So there's a lot of different things we can do for people with stroke patients to try to get the body to heal. Because the brain, when I went to school, I was taught that the brain, once a cell is dead, it's dead. It's not true. The brain has this ability called plasticity. And plasticity, it's like plastic. It can reshape and remold itself. So in many cases, when there's brain injury, the body can heal itself and remodel itself, which is kind of cool. And of course, you have broken bone. Don't jerk around with that. Get to the doctor right away. I've broken many bones in my life, and every time I went to the doctor, and every time I was glad I did. So folks, I'm running out of time. If you have any questions, go to our website, drjoe.com, drjoe.com. You can send us questions through the website. Follow us on Facebook and Instagram at Dr. Joe Esposito. Please follow us on Facebook and Instagram. That's your homework assignment, because the more followers we have, the bigger influence we have over people. If you do want to make an appointment, drjoe.com. First visit is normally $375. We've reduced that to $199. We do accept insurance for treatment after that. We have x-rays in several of our offices. We can take x-rays right on site. We want to be your doctor. And if you're a VA patient, if the VA refers you, from what I understand, the VA is going to cover your bills too. So drjoe.com. If you have any questions, our website is available 24 hours a day. Thanks for tuning in. We'll catch you next time.
Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.